There's more patients landing in care settings than ever. And then you've got a shortage of healthcare providers in all settings trying to manage a larger volume of patients.
The only way you do more, deliver better quality with less, is through technology.
If a patient needs to move from one care setting to another, there's not a good transfer of data, so those transitions aren't smooth. And that's tough on the patient, and it's tough on their family, and it's tough on those who care for those patients.
It's a really complex problem, and we looked at this back in 2015 and wrote a strategy that said if we could reduce the friction that providers have interacting with each other, if we could allow for a patient to transition from one care setting to the other, we'd solve a tremendous industry problem. We've been acquiring assets like Brightree and MatrixCare, investing in our own innovation and R&D efforts, and now we have an offering that allows us to deliver solutions in durable medical equipment, private duty, home health, hospice, skilled nursing, assisted living, and life plan communities. That forms the basis for the most comprehensive out-of-hospital software offering that exists today in the US market.
You've brought together some very rich solutions that now's the time to really start working and connecting those and removing the friction points between the transition of care and patients moving from one setting to another and how they get their durable medical equipment at home and electronically doing a lot of those transactions on how paperwork moves and access the data.
It's bringing these parts of healthcare together, and that is something that ResMed SaaS can do uniquely.
We've shown that we can make the right investments in technology, we can acquire the right businesses, and that we've assembled a unique, unified platform for out-of-hospital care. That lets us drive our mission to reach 250 million lives by 2025, allows us to innovate around the provider networks, allows us to innovate around the patient, and allows us to do something unique in healthcare that's never been done today.
We are
well connected.